Hello, my name is Denis Marcelin Little.
And I'm Barbara Filliquist, and today we will be sharing a tutorial on how to perform hip arthroscopy using needle arthroscopy in dogs.
Needle arthroscopy is a minimally invasive procedure using a very small diameter arthroscope, often 1 to 2 millimeters, to inspect, diagnose, and sometimes treat interarticular joint problems. Indications for hip arthroscopy include articular cartilage assessment, synovial biopsy, identification and treatment of septic arthritis, identification of labral and ligamentous tears, identification of minimally displaced articular fractures, and a diagnosis of impingement. The needed supplies are first gathered. They include an empty 3 or 6 ml syringe for joint fluid collection and a 6 or 12 ml syringe filled with sterile isotonic crystalloid, such as LRS, for injection into the hip joint. Additional supplies needed for access to the joint include a long 18-gauge needle or an 18-gauge 5.5-inch long spinal needle, a wire or pin cutter, an 11 scalpel blade, and small hemostatic forceps. An arthroscopic tray containing instruments needed is helpful. That tray should include the number 11 scalpel blade and blade handle, small straight hemostats, 18-gauge needles of varying lengths, and probes of varying sizes for palpation of joint structures. Also, a needle holder, thumb forceps, and scissors are needed for closure. The dog should be anesthetized, placed in lateral recumbency with the affected hip joint up, and secured to the table such that gentle traction can be applied to the limb. Today, we'll be viewing a left hip joint. An appropriately sized window is clipped over the hip joint. The region should be aseptically prepared for the intervention and draped in. The limb is supported in a slightly adducted or neutral position with the femur parallel to the ground. Flexing the hip joint slightly opens the joint space. The femur can be internally and externally rotated during palpation to identify its center of rotation. To locate the hip joint, the greater trochanter is palpated. Due to the anteversion of the femoral neck, the hip joint will be located cranial to the center of the greater trochanter. An 18-gauge spinal needle is inserted perpendicular to the skin, cranially and slightly dorsally to the greater trochanter, with slight distal limb traction achieved with the help of an assistant or with the use of a limb distractor. A small pop can often be felt as the joint is penetrated with the needle. The stylet is removed and joint fluid should be aspirated back to confirm that the needle is in the joint. Joint fluid should be saved for cytology and culture if indicated, and the joint is distended with 4 to 6 ml of crystalloid. There are several different methods of establishing the arthroscope portal into the joint. The first method described is the use of the spinal needle as a stylet. Once the needle position in the joint is confirmed, the hub of the spinal needle is cut using the wire or pin cutter. A 3 to 5 millimeter long stab incision is created in a proximal to distal direction along the spinal needle using a number 11 scalpel blade. A straight hemostat can be used to enlarge the superficial portal. The inflow sheath is inserted over the cut spinal needle, which is then removed, and the arthroscope is slid into the sheath. The second method utilizes a blunt probe inserted into the joint immediately adjacent to the spinal needle after the superficial portal has been enlarged with the straight hemostats. Once the probe is in the joint, the needle is removed and the inflow sheath is passed over the blunt probe. Once the sheath is in the joint, the blunt probe is removed and the scope is slid into the sheath. In the third method, the inflow sheath and the blunt trocar is inserted into the joint following removal of the spinal needle after the superficial portal has been enlarged with the straight hemostats. The blunt trocar is removed and the scope is slid into the sheath. Once the scope position in the joint is confirmed, fluid egress is established by placing an 18 or 20 gauge needle at the cranioventral aspect of the joint. In this case, for the left hip joint, it is placed at the 7 o'clock position. Fluid ingress is achieved using a pressure bag with a crystalloid such as LRS or by intermittently administering the crystalloid via a 60 ml syringe. Moderate distal limb traction is maintained during the procedure. The following structures are visualized during the exploration: acetabular rim, The labrum and joint capsule is seen when moving the scope from cranial to caudal. The caudal aspect of the labrum is continuous with the transverse acetabular ligament. Starting back in the cranial joint pouch, the femoral head, the acetabular notch, ligament of the femoral head, caudal joint pouch, and transverse acetabular ligament is visualized as the scope is moved caudally.
Thank you for watching.
You have seen how we can efficiently and safely examine all intra-articular structures of the hip joint in dogs. We hope that will be helpful for you.